I will never forget, 11 minutes and 53 seconds into that first session, his left hand opened like a flower.
He called me the next day and said I slept 7 hours and woke up without pain.
I mean, I used to do therapy and talk to people and listen to what they had to say. And I recently, for example, worked with a gal that was bipolar, and she did, I think, about 40 or 50 sessions without any medication, and she got really calm, really even. If I had just been doing talk therapy, I think we'd still be talking.
This whole arousal that would happen, she would just be so uptight with the pain and the discomfort and her whole over-arousal state, and she would just settle down and she would be better.
He told me about neurofeedback, and I said, yeah, right. Headaches go away, Seizures, sure. I've been a nurse forever. You can't tell me that works. So he came back a month later and brought the big computers and the whole neurocybernetics box, everything. And we hooked up a few people over the next few days, and I was blown away. I quit my job the next week and flew to Encino to take the class, and haven't looked back since.
Getting into neurofeedback is sort of a continuing education requirement, because now all of a sudden when you're doing neurofeedback, you have reason to be interested in how the brain works. And this is a good time because there's tremendous amount of information out there about brain function. So people typically come into the class as some sort of therapist, don't know a lot about neuropsychology, neurophysiology, but get interested. And then the reading becomes, starts, and all that information can be added as people go.
I was overwhelmed with the information. But Sue and Siegfried presented themselves in a way that I really decided to stay with it. I just decided this was a different language. I was in a strange land with people all speaking a language I didn't know.
You cannot imagine how much courage it took for me to do this. I'm not a computer thrilled individual. I mean, I have lots of computers and I use them all day, but that wasn't my thrust.
Neurofeedback is such an interesting discipline because it spans the two chairs. There is some technology. One has to be able to handle a computer, but it's not hard. And more importantly is the human element. It's really about working with people and helping people transform their lives. And where we've tried to go with the instrumentation is to make it very easy so as not to be too intimidating. We have quite intentionally tried to attract a wide variety of different professionals to this work. Each individual, each profession brings its own take. It's a different tool in different people's hands.
I got drawn into taking a look at neurofeedback as perhaps a way to work with attention disorders and learning disabilities and traumatic brain injury. I was astounded when I got to my first training for neurofeedback and discovered that it was also being used for anxiety and depression and eating disorders and you name it, whatever will walk through the door of a clinical office.
I've treated the body for 12 years, the physical body, and really would get to a certain point with a lot of patients that no matter what I did to their physical body, they just weren't making any progress. And the missing link was treating their mind. And knowing that actually was the foundation. I mean, once we treated the mind, these other things would fall into place, especially chronic pain, fibromyalgia, restless leg. I mean, there's just a lot of diagnoses that there's that underlying irritable reactive nervous system. If we treated that first, that, all these other things I was doing, I don't even know if I'd need to do them.
I don't really do talk therapy during the session because we're trying to find what I would call the right idling frequency for this particular brain that allows it to feel calm and comfortable and collected and think clearly and relax well. And if you're talking about emotionally intense issues, you'll never get there during the session. So it's a real change of pace because what you do is you're talking to the patient about very specific symptoms, sleep, mood, very specifics of how they're acting and behaving, managing their temper outside the office, that kind of thing. But you don't go for the story of it, you go for the existence or non-existence for that problem. Is it more intense? Is it less intense? Did it last longer? Did it get shut off sooner?
The way I incorporate neurofeedback into my practice as a speech pathologist is what I will do is I'll bring the student in or the child and I will give them about a 10 or 15 minute session. It's priming the pump, so to speak. The children are able to do the exercises with much more ease.
I've had parents who have said, you know, I think my child's addicted to this. And I said, well, I don't think you can do that, but why do you think that? Well, he really likes to come and do it, and he asks, when are we going to go do it again? And of course, while Mom was there, I interviewed him, and his response was, I like how it makes me feel. I feel relaxed, and I feel like I can focus.
With EEG, if I'm dealing with someone, let's say, who has auditory processing issues, you can use lots of different educational products to do that, tutorials, and then you can bring on neurotherapy, and then you can get the job done. And together, they're incredibly powerful.
I work primarily with children with different types of neurologic injury, ranging from brain injury, brain tumors, fetal alcohol exposure, other toxic exposures, and have found it extremely useful, in contrast, using medications in reducing symptoms and improving their functional capacity.
It's such a privilege to do this sort of work and to have the influence that we have, the impact on people's lives. And what I love particularly is the particular relationship that we have with our clients. It's more of a coach than as a therapist or a doctor. We're not fixing people, we're empowering people to become themselves and to function better in the world. And that's just a beautiful thing to do and to see.
I love moms' reactions. I just love what moms will come in and say. You know, I'll have run, you know, their child, and they will come back the next day and almost on the verge of tears that they're so excited because they'll say, you know, after we left here, you know, things didn't go well for the rest of the evening, which normally would send my child into a temper tantrum, and they just flowed.
It's a wonderful position to be in to treat people, and it's a wonderful position to be in to keep learning about the brain and what things we can do, and I think we're learning more all the time, so that makes it very, very rewarding and exciting for me.
We really are meeting the goals of psychotherapy faster, easier, swifter, and better.
I love it. I can't imagine life without it.